Hi everyone, and welcome to another episode of Tiny Matters with Dr. K. It's the Easter holidays and your 8-year-old son runs into the room bursting with excitement. His cousins are visiting and they want to do a sleepover with movies, snacks, games, the whole adventure. He looks at you and asks, "Mom, can I sleep over with them tonight?" And for a moment, your heart sinks. You remember what happened the last time. The wet sheets, the embarrassment, the quiet tears the next morning. And now what should be a joyful childhood memory is suddenly filled with anxiety and worry for him and for you. Bedwetting is something that many families deal with quietly, with frustration, confusion, and often with shame. But the truth is, bedwetting is far more common than many of us realize. Your child is dry and perfectly toilet trained during the day, but come the night, the bed is wet again and again. Sometimes it may go on for months. And naturally, as parents, we start to wonder, is there something wrong? Should my child have outgrown this by now? So today we're unpacking bedwetting, also known as nocturnal enuresis, when it is normal, what contributes to it, and what you can do to make things better. First, how common is bedwetting? The first thing I want parents to know is this. Bedwetting is very common. In fact, at the age of 5, 15 to 20% of children still have nighttime accidents. Even by the age of 7, around 10% of children may still experience occasional bedwetting at night. And every year after that, children will gradually outgrow bedwetting as bladder control and sleep patterns mature. So if your child is still wetting the bed, it can be normal and you are not alone. So why does bedwetting happen? Nighttime dryness depends on several developmental patterns working together. Firstly, a child needs to produce less urine overnight. They need a bladder that can hold urine and a brain that can tell them when the bladder is full. In younger children, these systems are still developing. Some children sleep very deeply, and their brain does not respond to bladder fullness signal cues. Others may produce more urine overnight. As it is in many cases, it's simply a matter of developmental timing. One factor that parents don't realize is just how strong the genetic link can be. If one parent wet the bed at night, the risk of your child bedwetting for a long time is increased, even more so if both parents wet the bed at night. So sometimes something that can be so frustrating is actually just genetics at play. Another hidden contributor is constipation, something that pediatricians see very often. A child who is constipated may have a large amount of stool in the rectum pressing against the bladder and causing weeing accidents to happen more frequently than they should. This pressure can reduce bladder capacity and also make nighttime wetting more likely. So when we evaluate bedwetting, we have to ask questions around hard stools, painful bowel movements, and stool infrequency. If we treat the constipation, often the enuresis gets better too. Now, while bedwetting is medically common, it can still be extremely distressing and frustrating for children and families alike. Children may feel embarrassed, ashamed, anxious about school trips and sleepovers, and very worried about disappointing their parents. This is why one of the most important things to do is remove shame from the conversation about bedwetting. Bedwetting is not laziness, it is not defiance, and it's not something your child is doing on purpose. Punishment and criticism can actually make the situation worse. So what can you do at home? Here are a few practical things that parents can do to help bedwetting at night. First, encourage regular daytime hydration and toilet visits. Second, make sure children empty their bladder just before bed. Third, manage constipation if it's present. Some families also find success with setting bedwetting alarms, which train the brain to wake up when the bladder is full. These devices can be very effective, but require consistency and patience. Now, while bedwetting is common, there are a few scenarios where evaluation is very important. parents should consider seeing a clinician if bedwetting persists beyond late childhood, say 9 to 10 years of age, if there is daytime wetting, if the child experiences pain with urination, or there are frequent urinary tract infections, or bedwetting that starts suddenly after a long period of dryness. These situations may suggest underlying conditions that need further evaluation. For most children, bedwetting is simply a part of development. With time, bladder capacity increases, sleep patterns mature, and the brain becomes better at waking in response to bladder signals. Most children will eventually achieve nighttime dryness without long-term complications. So if bedwetting is something that is affecting your family right now, remember, it is a normal part of childhood development. Approach it with patience, support, and reassurance. Children do best when they feel safe and understood, particularly with things that make them feel vulnerable. Thank you for joining me for another episode of Tiny Matters with Dr. K. Until the next time, stay kind and stay curious.